with that, let's go ahead and introduce our topic. Topic for our webinar today is SEL and addressing mental health challenges in schools, which is a really broad topic, really important topic, especially after the last couple years that we've had. And I'm thrilled at the panel that we have with us today. We've got a couple returning and one new member of our panel. And I'm going to spotlight everybody so we can all be seen together here. Let me introduce our panelists and then we'll jump into the discussion. We're going to go for about an hour today, and kind of like our pattern has been. So our panelists are as follows in no specific order. First, we have Dr. Christopher Pugliese. Chris practices servant leadership. In addition to his role as Director of Pupil Services, he also serves as Head of Partnerships for Circles of Support. Chris is a Level 1 Google Certified Educator, a Center for Supportive Relationships Certified Relational Skills Coach, an NASP-certified PREPaRE Trainer, and a member of the Trauma Informed Education Coalition. Completed his doctoral research on the influence of teacher-student relationships on teacher well-being, and is committed to implementing the findings to improve relationships and well-beings in schools. He's presented at many state and national conferences. Since 2017, he's been a featured speaker in the Introduction to Teaching undergraduate course at Neumann University and contributed articles published in ASCD Express, Pennsylvania, Texas Educator, etc. Welcome, Chris. We're thrilled to have you.
Thanks, Jason. Great to be here. Thank you.
Next, we have Dr. Larissa Henderson. Dr. Henderson currently serves as the National Association of Pupil Services Administrators President. She's the Director of Pupil Services in Oak Ridge School District in Oak Ridge, Tennessee. Larissa wears a lot of different hats. She does everything from attendance, discipline, food services, foster care, homeless, migrant, immigrants, ELL, school nurses, and court liaison, just to name a few. Title IX coordinator, Title VI and Title III. She calls Pupil Services the customer service department for the school district. Dr. Henderson feels the most rewarding aspect of her job is working with and helping students and their families. Her day changes hourly and the changes can be overwhelming, but she enjoys a good challenge every now and then. Welcome, Larissa.
Thank you. I'm glad to be here as well.
And last but certainly not least, we have Terry Bracken. Terry's the Director of Special Education and Student Services for the Garnet Valley School District located in southeastern Pennsylvania. Terry attended Villanova, where she achieved her BA and certifications in elementary and special education, Masters of Science in Educational Leadership, and Superintendent Letter of Eligibility from St. Joseph's University. This marks her 24th year as a public school educator in the field of special education and 17th as an administrator. Welcome, Terry. We are so happy to have you.
Thank you. Glad to be here.
And then I am Jason Johnson. I'm the lucky individual that gets to moderate these. My background is I'm a school psychologist. I was smiling. I saw a few people that introduced themselves in the chat as school psychologists. It always makes my heart beat just a little bit. They're my people. But I've been with the WhyTry organization for about 6 years. We're the organization that hosts these. I came over from public ed, where I was for several years there. I worked in elementary, middle, and high school. Absolutely loved what I did, and this has been just an awesome experience as well. So without further ado, I want to get into our topic on the day. And the way we typically do these is kind of like a little bit of a round robin format where I'll present some questions to our panelists and just ask them to respond in a specific order. We'll kind of change it up so we hear from a different order in voices depending on the question. So to start off with, just to kind of get us all on the same page and help give a little more background to our attendees on who all of you are, I was wondering if you could each tell us just a little bit about what your role is and the work that you've been doing to support mental health in the districts that you serve. feel free to tell us a little bit like what the last year has been like. I know it's been a very unusual time in education. And so let's go Terry, Larissa, and then Chris.
Okay, so as my role as the Director of Special Education and Student Services, I oversee the school psychologists and also work very closely with the school counselors. And we have a pretty robust program that encompasses mental health for our students. We do a lot of risk screenings and assessments. And over the years, as we collected data, we felt that it was important to focus on the reentry of our students after they had been in a hospitalization program for mental health services. So we began to do what we call our reentry program as students come back from mental health placements. We have a team of folks in the district that meets with the family as well as the student, and a mental health caseworker will then see the student for 4 sessions as they transition back into school. And they help with the language of, why were you gone? Where have you been for the last 2 weeks? And also just periodic check-ins with the student to make sure that the treatment that they received through outside services is still being followed. They have access to community resources. We try and hook them up with community-based resources. So that's a program that we have expanded over the last year and a half because we were able to look at our data and the rising number of evaluations and risk screening and assessments that we were doing. It was growing exponentially year after year, and we saw such a need for increased supports in mental health within our school systems, particularly at the middle school and high school, but also alarmingly at the elementary level as well. So, over the course of the last year and a half, this didn't decrease by any means, but we also didn't have access to our students as we would have liked because many of them remained virtual, but we were still able to provide that level of support. And because of the data, we were able to provide a full-time counselor in our district through grant funding. So that has been extremely helpful. And that's one area that we've been able to really work on in supporting our students in mental health, increasingly support students in mental health.
Awesome. Thank you so much. I know I've been really impressed as I started learning a little bit more about what you all were doing. It's I think you've really set a really nice standard and created a pattern. I think that's really worth other people looking into. Larissa, let's hear from you next. Tell us a little bit about what you've been doing to support mental health.
Okay, here in Oak Ridge, we're a small school district. We have about 5,100 students in 8 schools. Each school has a full-time counselor, a full-time nurse, and we also have school psychologists that are assigned to the buildings as well. I also have a coordinated school health person who works out of my office that I oversee. One of the things that we have to do for that with the coordinated school health, we focused our district plan on mental health. Mainly at the student level. And we looked at last year looking at a lot of the kids that when we went virtual, hearing from the PTO and PTA groups from the school levels, saying that a lot of the parents were saying they could see anxiety and depression and so forth with those kids at home because they're not interacting with, their peers or teachers like they used to. So we came up with some stress relief bags. We got sent information out to various agencies in Oak Ridge, to some sororities and so forth. And we stocked those bags with bubbles, stress balls, coloring books, anything that would kind of help the child relieve stress and some anxiety. And since the schools could identify those kids easier than we could, we delivered the bags to the schools. And then they delivered them to the students, and they took pictures as they delivered those. So that was a big plus. We also got our school board engaged in that and brought them up to speed about the mental health and so forth as well. And we gave them their own little stress relief bag at a board meeting. Some of the other things we're doing is during our professional development time, we are providing training and webinars and stuff to our staff on the emotional part of the learning piece and what they can do, how to detect depression and anxiety and so forth. Also with staff, we also did that with staff. So we're looking at everybody because COVID did impact everybody, not just the students, but parents, as well as the students as well. We do have students that sometimes, due to overwhelming things happening at home, they are referred to outside agencies. And I am the bridge between them, the outside agency, and them coming back to school. So what I have done is set up that connection. The parents will contact me. We'll have a meeting to see kind of some of the supports that they put in place at the facility and try to mirror as close as we can some of those things, and then look at what we're already doing in our school as well. With some of the mental health and the anxiety things going on, our administrators, I had them look at discipline a little bit differently, because I found out that a lot of the discipline is not them just acting out to be acting out, but it's coming from some of the stressors at home as well, because some of these kids were losing family members and relatives, and a key core component. So we are working on that, and we always offer training. We always meet back and try to go from there, and we do have services within our community that we reach out to as well and try to support them with our kids. So we've got I would say our village for the kids, educational village, is growing to include the emotional part of it too, as well as for the parents. And
I love that. I love that. And I know I learned about those stress relief bags during the pandemic when you were doing those. That was actually a highlight for me, learning what you were doing with those. That's such a great idea. So awesome. Thank you. Chris, tell us a little bit about what you've been up to.
Thanks, Jason. First, I just wanted to comment on Larissa. Compliments to you for focusing and mentioning staff, focusing on the importance of staff. I think that very important. Certainly our job is to take care of children. That's our end goal. But if we need to take care of the adults as well, so they can take care of the children. So well done there. With respect to my role, I want to share two, sort of the two roles and then the two different initiatives that I'd love to be able to share. And my role as Director of Pupil Services here in Upper Darby School District, I'm really proud of the fact that this past year, we developed a K-12 social and emotional learning curriculum. I was part of the development at the elementary level, the K-5 level. We worked with an outside provider, Lakeside. They helped us take our existing PBIS structure and enhance and strengthen that by incorporating Castle's 5 core competencies into those lessons. So what we're excited about is starting in the next school year, we have a proactive lessons, weekly lessons that we've developed for our classroom teachers to provide to our elementary students. And we're excited about that because it's proactive work. It's upstream work. The idea is that teachers will be delivering lessons on social and emotional learning, and so we're excited about that. We think that's we're really excited about moving that forward. The other initiative, the other role I serve is as part of Circles of Support. We have a proactive wellness suicide prevention system. We're really excited about. It's a system that checks in with students on a weekly basis, checks in with how they're doing. What we use there is we use SAMHSA's 8 dimensions of wellness. So it's checking in on social relationships, sleep, exercise, effectiveness, all these different areas. That system gives students a chance to respond immediately how they're doing. And it also, if they're struggling, gives them a chance immediately, a text message with a link to resources that are in place. So those are the two, I think, really important initiatives I'm a part of. One, the social and emotional curriculum in the school system, as well as the proactive well-being check-in, suicide prevention system that checks in with students on a regular basis.
Awesome. Thank you so much. Thanks for giving us those updates. By the way, I've seen that check-in system. Super cool. It's really cool. It's using cell phones and stuff. It's awesome.
Thank you.
Tell me, so now is where I kind of want to shift over to specifically what we can be doing, what we should be doing, what we should be looking for. I want to talk now, get your opinion on what do you think schools and school districts should be doing to promote and contribute to positive mental health support for their students right now? Like, what should we be looking for? What should we be preparing for in this upcoming year? Because this is definitely unprecedented times. Re-engagement right now is going to look different than re-engagement ever has before, given what we're all coming off of. So let's go Chris, Terry, then Larissa on this one. Tell us what schools and school districts should be doing to prep for this.
My theme, or the piece that's really important to me, is balancing the proactive sort of upstream work with the crisis response work. And, certainly we need to have in place systems that respond to crisis as students and staff, have high levels of concern, and that's extremely important. At the same time, though, I think we always need to be building those proactive upstream systems or supports, because when things are calm and things are going well, that's the time that we really want to strengthen our people. We want to give them a chance to their skills, so that if and when a crisis happens, they're able to respond and because they have the strong skills. I think what I've seen, and it's understandable completely, sometimes we'll go through a high level crisis situation, we'll get through it, things will be okay, and then we just sort of, not that we forget, but that's the time right then when things are good that we want to build skills. So I think for me, the message is balancing both having systems in place to address crises as they come up, high level situations, but also build those skills when things are calm and things are going well. Build people's resiliency, build the skills that will help them avoid a crisis or respond to one better down the line.
Awesome. I love it. And it's so consistent with how we teach kids anyway. I mean, that's the strength-based approach, right? And then when we have that moment that we can build, then we build up additional strengths. When we have that, we build our own capacity, right?
Amen.
Terry, then Larissa.
Yes. So my school district is focusing on a couple of things. We're looking for universal ways to approach social and emotional learning, and some screening tools for social and emotional learning. Also, we have a global citizenship committee that has established pretty much a course in our online system, where our staff will go through this course and will participate in this global citizenship work, where we focus on not only social and emotional learning, but also community involvement, community supports, and a lot of the really tough issues that we have seen come to the surface over the last year and a half. Not solely due to the pandemic, but maybe more pronounced due to the pandemic. So we're trying to focus on some of the really tough conversations and addressing them with our staff, because we know that they're going to get them from the students as well. So like Chris and Larissa said, while our obligation is to provide services to students, we can't really do that without a really strong team in place to be healthy and well enough to do that. So part of our work also is contributing to the positive social and emotional health of our staff. And I think by putting information out into the community and to our staff on a regular basis, by informing our school boards of the things that we're doing to address mental health services within our schools, because they do get questions about about this topic. It is sensitive, and if our school board knows how we're addressing these tough issues, they can help us spread the word.
Awesome. Thank you. Real quick, I'm going to put you on the spot here. Hopefully not too bad though. Somebody did ask what screeners you favor, what screeners you've been using for your universal screeners.
We have not selected one yet. We're still in the process of taking a closer look at that. I mean, right now our district does participate, and I believe Chris's does as well, participates in the PAYS survey, the PA Youth survey, which gives us a lot of really good information. But it's only done every other year. It takes a long time for this survey results to come back, but it does help us to put proactive programs in place for our students based on the responses that we get to mental health, drug and alcohol, you know, how people feel connected to the community and the family. So we've been using that data for a long time. We've also done some other youth surveys that have given us some information. The downfall to that is that it is anonymous, so we can't necessarily look more closely at the data, but it does give us an overall picture. And I think what we're looking at right now is more specific information so that we can look at those protective factors and have individualized student data so that we know how each child is reacting to various topics under the social emotional learning umbrella, but looking at more the protective factors rather than, you know, is this not necessarily a suicidal screening or, you know, a check-in. We do those individually with students who would be reported to us or who may come up in the concerning range. So we haven't identified a particular screener at this point.
No worries. Thanks for responding to that. And I love that answer. You know, from a resilience standpoint, that's where my research is and kind of where we're at organizationally. Our approach to SEL is always built around the resilience piece. The protective factors are always vital, but the protective factors also are what really allow you to take a really a more early intervention approach as well, because we can try to build those out really proactively. So awesome. Thank you. Larissa, you're up. Tell us a little bit about what you're looking at, what you think schools and districts should be doing to promote and contribute to positive mental health, especially coming into this kind of unprecedented upcoming school year.
Okay, well, I think number one, we need to look at mental health, the definition of mental health. I think when you hear the word mental health, people look at it as kind of a negative, that something's wrong with you kind of thing. But you can have positive mental health. And I think coming up with a definition that works for everybody, that's on the positive note and not the derogatory note. A lot of times when I do discipline hearings and I'm talking to the students, I have gotten comments back from kids that thank you so much for talking with me and not at me. So that's a difference. They feel respected. Everybody needs to feel that respect. But at the same time, we need to include the whole community. Or the whole village, as you want to say. If you heard the old saying, it takes a village to raise a child. Well, the same thing in education within that village. And then I also tell them if they're having issues of depression or anxiety, you know, especially when they come to hearing and that comes out, and I see this deer in headlight look on the parents. And I'll say, you know, I can understand that there's days when I get kind of depressed with all the stuff that I have to do. And the way I relieve it is that I go, I said, my best stress relief is, I said, I love old school music. So I will go put in old school music and I will go to Baskin Robbins and get a double scoop of lemon custard ice cream. And I'll just drive till I eat the ice cream up. And I get the same grin from them that I'm getting from you, Jason. And then they'll start talking about things that they like. So the whole mentality changes. So I think letting people know it's good. There's a positive side to mental health as well as one that needs some help, crying out for help. I don't want to say it's derogatory, but I think it's the way we approach it and give those skills. So I'm trying to get the staff to see how to look at the positive end and how to ask the questions to get the information to help the child. A lot of times I will have parents say, thank you so much. We did not know our child was going through those kinds of, had those kind of emotions because they wouldn't talk to us. But if you're talking to them, they're not. If you're talking with them, it's a whole different thing from that. So I think just educating everybody, because everybody's got some kind of mental health issue going on. And it doesn't mean there's something really wrong with you, because it means you're human and you're going to have good days and bad days. Some things you look back on and laugh and go from there. So we just need to kind of look and see how we can educate everybody and bring them to that realm. People do have a taboo for whatever reason of going to seek out mental health services because of the negative connotation they've been brought up in that environment for whatever reason. And again, that's a generational thing. But I think if you say, well, everybody has some problems, everybody has good days, bad days, and you kind of go from there and build, I guess, a relationship on that. I mean, you're going to get more information from a child if you say, kind of tell me how'd your day go? What was really good? What made it change? Then you're going to get to the root of the whole problem, then coming in and asking them, why in the world did you do that? Kind of thing. So just kind of come up with some strategies and go from there. Again, we are including some workshops and professional development for our staff. We're also doing things for with PTOs and PTAs to try to help them get information out there as well. And I think just educating everybody, because mental health, people don't really understand mental health. And I think COVID made everybody aware of mental health more so than they wanted to be made aware of. So I think just kind of getting people to a point where they feel good about discussing it and then moving to the next step for that.
Awesome. Thank you. By the way, old school music and a double scoop of Baskin Robbins may be my favorite intervention I've ever heard in my life. That's fantastic. It made me think. I'm always kind of taking notes really rapidly while we do these. And I think I was just really struck at the unique position that the education system is to try to destigmatize some of these challenges we have around people's negative perceptions of mental health. I mean, that gets connected to the world of mental health, the mental health community and the medical community. But the reality is nobody is interacting with families more consistently than the education world is. And with the MTSS model, we're finally embracing mental health more proactively than we ever have. But I think we really can be a massive player in helping to destigmatize that concept of mental health based on our parent meetings and our meetings with kids. So I love what you said. That definitely struck me.
Yeah, and I think too, Jason, I've had parents call me and say, Dr. Henderson, I've got a problem. I want to talk to you. So I become a therapist, I'm sitting there listening to, and sometimes it's just something very simple. And I'll say, you want to set up a meeting with me? Would your child talk to me? And well, we'll see. And they'll call me back within a day or so and said, yeah, they'd be willing to come in and talk to you. So I go on a notepad and I'm just writing as they're talking. I'm not interrupting. I'm just letting them talk and go from there. And then I'll go back and kind of paraphrase what they said. And then I'll say, how can I help you? Okay. What are some things I can do to help you and help you at school, help you at home? So that way they feel like, okay, I'm included. Somebody's listening to me and kind of go from there. Sometimes they've got the solution, but they're afraid to come up and say it.
For sure. I think that leads into where I want to take the discussion next and talk a little bit about. So these are big ideas, and some of the feedback we always get, we'll give, challenges. People will express challenges either in funding or in support or just general bandwidth challenges. In the world of education, we all have more things to do than we have time to do them. And one of the best things I think we can do is to learn how to partner up with resources from our communities and resources that are around us in a better way. What are some ideas or tips that you have for how schools and for how individual educators can more effectively partner up with resources and help communities better advocate towards good mental health? And for this one, let's go Larissa, Chris, and then Terry.
Okay, I think one of the things when I was listening to you and this question, one of the things that I did as a principal, and I've been principal at 3 different inner city schools, which had 3 different inner city populations. One inner city school had 99.4% free and reduced lunch. Only had 3 kids out of the kids that came in that brought in money to pay for their food. What I used to do is a monthly newsletter that went to parents about what was going on in the building. And I also sent that newsletter out to the community resources that were close around that school. I also had a spring luncheon and a fall luncheon and brought those people into the school. And I said, I just want you to see our kids, see what we're doing, and go from there. So it gave the kids a chance to sit down and see community resources that they may see the buildings and never know who the people are, and vice versa. Just bringing the community to the table, more or less. And it was in a non-threatening way. We ended up getting one of the construction companies within one of the community, one community where I was principal. He was so impressed and did not know the need there that every month he was giving a monthly donation to us to do different things with. And I think I even sent it to our state representatives so that way you get everybody on the same page. You kind of see what the need is, because if you don't come into school, you have no clue what's going on. All you know is that they're doing educating.
That's incredible. And I apologize for cutting you off, but I want to find out, did that start just by you reaching out to the community and sharing that newsletter to let them know what was going on in your schools?
Yes, it started out with me, and I've done this at every school that I've been principal of, even when I was as a principal here in Oak Ridge as well. But that was my way. The first paragraph was an introduction. Hello, my name is Dr. Larissa Henderson, and I'm the new principal of Maynard Elementary School. And some of the goals we had said, we'd like for you to come in and visit. So when we had open house, they got invitations. Then I said, we set up, I think when I went out and wrote down all the little businesses within that community, I think we had about 20, even a little mom and pop stores and so forth, even the big construction. There was a construction company, and that guy, I think some of his contracts were like $2.something million. So all of them got an invitation and a newsletter. Again, our state representative as well. And when we had the luncheon, the first time we did it in the fall, we had about, I would say 8 out of the 20. Word got out. And when we did it in the spring, we didn't have enough room in the cafeteria for the people coming in. And my students were the tour guide. They took them around the building. They talked to them. PTO, parents were there. So we brought the community into the building. So, because we knew what we were doing in the building, but the community didn't. So those were some of the resources. And we had fraternities stepping up to the pump, wanting to come in and mentor some of the kids. We had a historically Black college about 3 blocks from the school. And the president of the college called me and wanted to be the guest speaker for Black History Month. Now, I didn't reach out to her, she reached out to us. And that was very impressive. So when you start throwing yourself out there, they come in and see the good things that are going on, and they want to contribute to that and go from there. So I think there's a lot of ways to hit people and get them the information. I know the being principal in Woodland, in Oak Ridge, when I got to Pupil Services, we have a day on the Hill where we go to Nashville, which is our state capital, and we meet with our state representatives. And I was with our school board, and we walked into Representative Randy McNally's office, and the superintendent at that time was introducing everybody. And when he got to me, Randy McNally looked at me, he said, "You're the one sending me those newsletters every month about what your school's doing." So it stuck. So that was the focus of the conversation, going back in the van with the school board and the superintendent. But I think letting people know what we are and what our needs are, Because as long as we sit back and procrastinate, we get nothing. But when they see we've got some legitimate needs, and sometimes the needs don't cost a whole lot of money, it's just having human resources come in and share their talent with us. So I think just kind of going out that way and doing that. So we got to start thinking outside the box. We started doing the same thing with, the kids, the staff, the parents. So I think the resources you have within your community, even within your school, are very vital. And the more you can supplement those and implement those little things, go a long way.
That's incredible. I love that. Thank you so much. Chris, let's hear from you, and then Terry.
Thank you. Yeah, just a, exclamation point to all that Larissa said, and just building relationships. I couldn't say it any better than what she just described. That's such an important way to help strengthen, the resources that exist in a school. The other thing I think is really important is know the mission and beliefs of your leadership, and work with that. And I say it this way, we're lucky. I'm lucky. I work in a school district where our board of school directors, our upper administration value social and emotional learning. So they invest in it. They will spend time and money and energy building programs that promote it. So we're really lucky. In some cases, if not everybody is seeing the same importance in another district, find the way to connect to what is important. So for example, if academic performance is really important to the leadership, make the connection between social and emotional learning and academic performance, because we know that one leads to the other. So I think understand and recognize, sort of the landscape, because social and emotional learning, promoting mental health is good for everybody. But finding the right avenue and finding the right way to connect is I'm fortunate that our school board and our local community understands it and believes it. But even in places where it's not as much of a priority, you can make that point by connecting it to what is important to your leadership.
Awesome. Great insight. That's been my experience in schools that I've worked at and that I've consulted with that are trying to get greater buy-in for that SEL piece. One of your best ways to do that is if you can connect that to the academic piece, because the academic piece will always capture attention. So awesome. Terry.
Yes, I would like to second the fact that I am very grateful for the fact that I work in a school district that values social and emotional learning and supports that within not just our schools, not just with our staff, not just with our students, but also in the external community. So I don't know that we really got into where we are located in the world. I know we have people from all over the US, and I think you mentioned Canada. I happen to be in southeastern Pennsylvania in a school district that has 5,000 students. It's relatively small considering what many of our district partners have as experience. Chris and I happen to be in the same area, and our school districts could not be more drastically different. I have a pretty high socioeconomic group of families, and we have maybe 8 to 10% free and reduced lunch and maybe 3% English language learners. But what I found over the years and in my experience in the districts where I've worked, that regardless of your socioeconomic status, you're always going to experience some level of mental health. The statistic that we see often is that 1 in 5 youth ages 13 to 17 experience some type of mental health disorder. And I will say that even in my school district that is relatively privileged, I see the same statistics apparent. So we are dealing with a lot of kids that have experienced trauma. We are dealing with a lot of students who are being raised by grandparents or other family members. And so our community connections are really important. We have a very strong community in this area, and that really helps us to make connections. We reach out to our community business partners and organizations. They do a lot of work with the school district, not necessarily with mental health, but with education and job study and other experiences that our students are able to have. And I think that is a proactive strategy, as we talked about in the last question. We post resource lists available for all of our families on our district website of counselors that are in the area, what insurance they accept, and then various groups that are run by some of our community partners. We also offer parent workshops. One in particular that comes to mind off the top of my head is something called Strengthening Families, where we bring families in for a course of, I believe it's 8 to 10 weeks. We provide them childcare, we provide them dinner, and we do a number of parent sessions with them. And that is always really well attended and supported by our families. We also have speakers on hot topics like the use of social media with teenagers and drugs and alcohol, and just really educating parents on some of those things that impact our students' abilities to be successful in school, and that may cause a social or emotional issue down the line. So those are just some of the community-based things that we have.
Awesome. Thank you. I think I'm going to combine and do kind of a two-part question. I have two questions here that I think are pretty related. So the first, here's how I'll combine them. So we have a lot of people on here that come from a lot of different backgrounds within education, corrections, mental health, and everybody has kind of a different level of support in their district. Everybody has access to a different level of resources. And one of the common things that we get, especially around this topic of mental health, is, you have like a staff within a school district, and a very small percentage of that staff actually has formal mental health training, and everybody else has kind of their academic and their teaching and perhaps administrative training. I wondered if you could share some ideas or strategies for how educators that may not have a background in mental health could improve mental health support in their individual classrooms or offices. Like, where should they start? If I'm a teacher or an educator that feels kind of like I'm on an island on this topic in my school, where could I start? And then the other thing I want you to kind of combine it with, the phrase gets used a lot, and I've heard several of you mention it, but the phrase is build capacity. And that's a common term in education, especially for administrators. How can we build greater capacity in ourselves, but also, for administrators to build capacity for their staff? So kind of a two-part question. Where can I start if I don't have a background in this? And then part two, how can I build my capacity, or how can I help build my staff's capacity as well? Let's go Terry, and then Larissa, and then Chris on this.
Okay, so I think that you can start, if you don't have a background on this, you can start off pretty easily by just listening to kids. If you're a teacher and you have a classroom, I think Larissa said, just sit down and listen. And class meetings are a great way to do that. Also, to incorporate some of the growth mindset language into your daily routines and curriculum. I took a course online. It was a free course, but it was very valuable on positive psychology. And I got to really become familiar with some of the growth mindset language. I pulled out a poster from the website. I carried it with me all day long, so that when I spoke to my own children, I started to use some of that language, and I really did start to notice a difference. It's pretty amazing. So those are just little things that you can do within your own classroom or your own family or your own environment to make a little bit of a difference right off the bat. And building capacity, I'm glad you asked that question, because I think one of the chat questions was related to, I'm a social worker, how do you utilize social workers? And I utilize my social worker intensively for work around social and emotional well-being for our students and for our staff and our psychologists, as well as our student assistance program coordinator. And our guidance counselors have been getting more and more into this as well too. So we do a lot of professional development. We give our team a lot of opportunities for professional development. We have sent teachers and counselors and emotional support teachers and social workers and psychologists to extensive trainings over the last couple of years that I've been in this position. Most recently, we have folks trained in DBT for schools, which is dialectical behavioral therapy, which is teaching kids how to identify and change their negative thinking patterns. It's a really great therapy, and the training that we've engaged in is specifically for schools. So it's not like we're providing really clinically based counseling inside a school. It is designed for schools. Similarly, we're sending a team of about 20 people in September for a 3-day training through the Beck Institute to a CBT for schools program, cognitive behavioral therapy. So we'll have the capacity to do both of those things with our kids, which is really great. And we got a lot of interest when I sent out the flyer. So we're fortunate that we're able to send those folks. Additionally, we have staff trained in QPR, question, persuade, and refer. And we do training for our staff. We do training for our 8th grade students, and we are going to be expanding that to 10th and 12th grade over the next year or so. And we're also going to be expanding that to parents. We are going to be offering workshops in QPR for our parents during Suicide Prevention and Awareness Month this September. Also, we do a lot of trauma-informed care training, and a lot of our staff members have been trained in youth mental health first aid. So that's kind of how we're doing it right now. And if I were to give any advice to someone who's just starting out in the classroom, I would say listen and have a lot of positive talk.
Awesome. Thank you so much. I'm going to lend my endorsement. I'm trained as in full disclosure, but this is a nonprofit group, the QPR Institute. I'm trained as a QPR trainer. The idea behind QPR is that is helping people that specifically don't have a mental health background to be able to recognize signs of suicidal ideation and help connect people that may be struggling with good resources, kind of like training people to be first responders when it comes to suicide prevention. Anybody can go through that through the QPR Institute. Parents, my endorsement of that would be any educator should take the opportunity to go through that right now, because it's a really, really important topic, and they do a great job trying to help you feel comfortable doing the things that you may have to do as an educator while still connecting with the mental health professionals as well. So great insight. I think next we're going to go with Larissa and then Chris.
Okay, I think some of the strategies, I was listening to some of the things that Terry was saying as well. I think it doesn't matter what school district you are or what part of the country you're from. Basically, you're going to come up with some of the same things that you're using. But I do know I have been trained through the state of Tennessee to be a youth mental health first aid workshop provider. So my coordinate school health person at that time, we went through all that training, and then we did various workshops. And then we started doing workshops at the building, at our district by buildings. So we had that natural resource there. And I think the thing that was good for that is that when they participated, we left them with a book that had all these tips and what to look for and the questions. So they've got a guide right there that they can write in and kind of go from there and refer back to. But also it opened up some things that we did not know was going on. We were doing one workshop, and this one participant that was a teacher, she just broke down and started crying. And she said, some of the things that you've said, I have seen in my child and had no clue what was going on. So it gave her an avenue to recognize that and go back and see, what she could do on her end for that. You talked about building capacity. I think one of the other strategies with building capacity is building relationships. You got to have those relationships, and they've got to be honest relationships. Kids can see a fake a mile off. So if they know you're sincere and honest and you're trying to help them where there's negative things that they don't want to hear, if they know you're being sincere, then that would open up that for them as well. And one of the things I try to do is to listen with my heart and not be judgmental when people are talking to you about different things. So sometimes just sitting down with kids and just listening to them. I'm a people watcher, and I guess being an administrator, that comes natural. But as a principal, I would go into the cafeteria during lunch and just sit at the tables and listen to the kids talk. You know, you could pick up on things that were going on with them and go from there. If something came out in the conversation, I'd come back and get with my counselor and I say, I think we need to talk to so-and-so. We need to kind of watch and see what's going on there. Because when they're around their buddies, they will let things out that they won't let out with another adult, kind of thing. So kind of do it from that end. And I think we need to help each other. If I know that I've worked with you enough, Jason, that if you come in one morning and I say, good morning, Jason, and you snap back, I'm going, oh, okay, something's going on with Jason. I'll give you your space. And then I'll start off, and I'm good with humor. I'll start off with something funny to kind of break the ice and say, let me tell you what happened to me, such and such. And then maybe you might share it, maybe not, but at least I found later people will come back because they feel comfortable and say, you got a minute? I just want to share something with you. I think I may be losing my mind. And I said, well, last Friday I lost mine, but anyway, let's see what we got and go from there. So I just think you need to build those things where you're not being very judgmental. We do have a lot of different languages in my district, and that's one of the barriers. We try to make them feel comfortable as well. One of the greatest hurdles that I had to get over to staff at the schools, they wanted everything translated in that language. We have more Hispanic families in our community, and that's that population is growing as well as some other different ethnic groups. And I told them, I said, and stuff would come back in Spanish. We send it home in Spanish, it come back in Spanish. And they would call and say, I want English, because they wanted to fit in. They did not want to feel different. But I think too, what they didn't understand, even though they were speaking a different language, they may be illiterate in that language. So we were sending stuff home that they could not read. So we were not making them feel any better. We were making them feel worse. And they didn't understand it. And I said, you have people in America who speak English that are illiterate. They cannot read. So why would we think another culture is going to be different? So I think when you build capacity, you build that relationship, you build that trust, where people feel comfortable enough to come to you at a moment you don't even think and want to talk. I always have an open door. I do take appointments every now and then, but sometimes when you just welcome people in, they'll share more with you than if you try to set up an appointment kind of thing. So yeah, I think that's part of it too. I think listening, not being judgmental, not asking a lot of questions, just let them talk kind of thing.
Awesome.
Yes.
Thank you so much. Chris.
Well, what I love about what Larissa and Terry just said, they both hit on it, is the importance of talking to students and listening to students. And I want to emphasize the importance of us as adults listening to understand first, not listening to solve a problem, not listening to give advice, listening to understand first, so that this person on the other side, whether it's a student or another adult, but so the other person knows that we're listening to them. Their voice is being heard. We're not just there to solve a problem or give advice or give guidance. So I think that's so important in terms of individuals, individual support. The other piece I would just add in terms of, Jason, your question about what kind of advice, where can people start? I really think that CASEL, Collaborative for Academic, Social and Emotional Learning, I think there are 5 core competencies. They're not the only entity that does SEL really well, but I think their 5 core competencies are a great place to start for somebody who just wants to get started, kind of outlines the key skills, gives some specific advice. So for a teacher who's, just getting into this type of work and really wants to learn, that's a good place to start, the CASEL 5 competencies. And then there's lots of SEL programs out there, WhyTry being one of them that does great work in this area. But I think in terms of starting foundational, I think that CASEL is a good place to start.
Awesome. Thank you. Definitely agree with the Castle endorsement as well. There's great. It's there. That's a deep well to dig through. There's a ton of great information in that. And we've definitely have aligned our material with their competencies as well. But there's some, in fact, if you go to whytry.org and click on webinars, there is an archive of previous webinars that we've done. And one of the last ones we did before we took our little summer break was with a good friend of ours that works for Castle. And she had some awesome information on there for both evaluating SEL programs, but also just for trying to bring good SEL information into your world. So I'm glad you mentioned that, Chris, because I think that's a great resource. We're going to put up contact information for our panelists here in just a little bit. And they've all been very, very generous, and they're very sincere about this. They're very, very happy to hear from any of you. And so I think they all have some nice areas of expertise. If you have some specific questions for them, they'll be happy to hear from you. I know, I think Chris's insight on SEL in general would be great for any of you that have questions for him. But there's been some great strategies shared. We're about out of time. And so I think what I want to do to conclude is I'm going to give you your choice. I'm going to give you our panelists your option. I'm going to give you two questions. You can respond to either one or both, I suppose, if you want to. I want to find out from you either what is a success that you've experienced over the last year that you're particularly proud of, or what is something that is giving you hope right now. So either pick a success that you're proud of to tell us about, or just tell us something that's giving you hope right now. Let's go Chris, Terry, then Larissa, and then I think we're going to be up on our hour and we'll wrap up. Go ahead, Chris.
I said my success, we developed this SEL curriculum for K through 5. So, but what gives me hope has always been and continues to be people, the resilience that people show, the kindness, the generosity, the strength that they show. And for me personally, this past year, I work very closely with our school nurses. Our school nurses were absolute, heroes, throughout the pandemic. They were put in a position where we were asking so much more from them, and they just stepped up in a tremendous way. So, in particular, our school nurses give me a tremendous amount of hope.
Awesome. Thank you. Terry.
I also talked about our successes when I said that we expanded our counselor for the Reentry Program, which we were able to expand to a full-time position and give students who have experienced significant trauma more intensive services. So that was a success. And what gives me hope is that people are talking about social emotional learning and mental health. Oftentimes us pupil services people are left on an island all by ourselves, and we're left to compete with the curriculum folks, and we're left to compete with the importance placed on instruction and curriculum development, and yet if we don't have healthy kids in front of us, it doesn't matter what we stand up and teach them. We need them to be healthy, happy, and safe. And I think that the fact that this has become the #1 topic in education right now, if I have to give a win for COVID, I'm going to give it that one. So I'm proud of our communities for doing that. And I think that it'll help overcome the stigma.
Awesome. Thank you. Larissa.
Okay. What is a success over the year? I think one of the things I consider a success, looking back over my school system compared to other school systems around us, and we were very proactive with all the precautions for COVID and some of the other things that we had to deal with. We did not have to shut down any schools. We had very few kids that tested positive, and I didn't have discipline hearings until May. So that was really good. So, and I think parents now know exactly what teachers do. because some of them that did do the virtual had to teach their child at home, and they found that their child's a little bit smarter than them because they were learning things that they probably didn't see until high school or college. What is giving me hope right now? I think the hope is that I can see things working. I can see children that I've been in education long enough that I can see some of the kids that have come through the school systems where I was either a teacher or even here in Oak Ridge as a principal, coming back from college, contributing in a positive way to their community and bringing good assets and things back. I think what it's also done is opened up the segue and for people to look at mental health in a positive way, that we need to sit down and talk about it. And it doesn't mean that you're crazy losing your marbles. It means that everybody's got that breaking point. And then you kind of deal with it and the best you can and talk, and they're looking at avenues to help themselves. So I think right now it's giving people some avenues and some resources that they may not have known that were out there that they can rely on and fall back on as well.
Awesome. Thank you so much. I'll add mine. What's given me hope? Two things. One, just to endorse, the last year I've heard more people talking about SEL than I ever have before. And I love that because I really believe in that as a critical piece to helping prepare kids to be successful in life. When we combine SEL with academics, it just makes a huge difference. And then two, I think it was Terry talked about having the importance of having some difficult conversations. And I am so impressed with this generation of kids, of youth right now. They've not only navigated an unbelievably difficult collective traumatic experience, but they are having really big, really important conversations, in many cases at a more mature level than the grownups in the room are able to have it. And that gives me so much hope. I really think that we're in some good hands going forward. And I'm so thrilled to be able to be party to it. Now, before we finish up, I want to throw it back to Larissa. So all three members of our panel today are part of the NAPSA Association, and they're a really, really important organization, and we're so thrilled to have the relationship with them that we do. They have a conference coming up, and I want Larissa to be able to share a little bit about that, who it's for, who would benefit from it. And I have it on good authority that a good friend of ours named Christian Moore is going to be presenting at that conference.
Yes.
Larissa,
yes.
Tell us a little bit about that. Who should come to that?
Okay, anybody that's on this webinar can come. Because pupil services encompasses a lot of different households. I would say educational households, from your psychologists to your administrators to your teachers to guidance counselors. We try to bring in people and have workshops that cover everything. We're going to have it in Pittsburgh. And there's the website for NAPSA. You can log on to that and click on the upcoming conference. It's going to be in October. We are looking at doing something a little bit different. We're looking at hosting it virtually as well as in person. And there is an agenda for both. So if you decide, or if your district says you can't travel yet, you still would be able to get the information via the virtual piece, hear the speakers via Zoom. We'll send all that information out, or we'd love to see you in person and go from there. I think we're going to have WhyTry there, as well as some other organizations there to present, and speakers. We're focusing on trauma and being resilient, because that is one of the focal points of everything right now. So I know you will have a good time. We're a small organization. We're not very, very big in number, but we're very, very big in heart and giving out information. We'll let you know what's going on the Hill. We even have a legislative liaison that's part of the NAPSA group. So please, if you can come, It's in October. I was trying to find my dates here, but if you log on to that website, you will see the dates to come and the hotel information, as well as become a member. When you become a member, a lot of the information that that is going to be shared at the conference will be on the website as well, so you can see that and go from there. And also the membership dues and how to do that as well. So we welcome you if you're not already a member of a pupil services organization.
Awesome. Thank you so much. Well, this has been fantastic. I'm going to go ahead and conclude this just with a genuine, sincere thank you to our panelists, Larissa, Terry, and Chris. You all did fantastic. And the chat was really amazing today as well. There were so many good ideas and resources being shared in there. Thank you so much. Huge thank you. So by the way, big virtual round of applause to our panelists. Thank you so much. Thanks for sharing your experience, your expertise. And then a huge thank you to our attendees. Thank you to all of you for being on here. We're so excited to have the relationships and be part of the network that we do. And I love getting to know more and more of you that keep showing up to these. Please come back for more. Next week, we've got an exciting one. We're going to have a panel of an principal, a counselor, and a teacher. And we're going to be talking about school connectedness and really trying to prepare our schools to help our kids thrive as we return to the new school year. So thank you all for navigating this crazy year. I hope you've been recharging your batteries over the summer. Please go out and do something awesome if you haven't yet, and keep those batteries charged. And looking forward to a great year upcoming. We've got an uphill battle ahead of us. We've got a lot of ground to make up, but the most incredible humans in the world do what all of you do. And I'm so inspired every time I have all of you on here. So thank you again. We're going to go ahead and shut this down.